So we're probably going to get started pretty soon. We're starting to get a lot more people on the call. And this is going to be about 40 minutes of conversation and maybe 10 to 15 minutes of Q&A. So I definitely want to leave some time at the end for folks to ask questions. And just to kick it off, I don't know how many of you guys know about Techwadi or even who I am. So I'm just going to quickly introduce myself. I'm Yasmeen Turayhi, and I'm on the board of Techwadi. And I'm also a product marketing executive. So I actually work with a lot of different companies across a lot of different verticals and industries and growth stages, and some of them in the mental health and wellness space. And for those of you who are not speaking, if you don't mind muting, that would be great. Awesome. And so you might be asking what Techwadi is. Techwadi is a nonprofit that is dedicated to building meaningful connections and partnerships for entrepreneurs and investors across Silicon Valley and the MENA region. And the reason why we're hosting this webinar is because mental health right now is really the topic of our time, and it's really the disease of our time, mental health issues, and particularly so with COVID-19. And, I just, before this call, I started looking up some stats on mental health. And according to healthypeople.gov and the National Alliance on Mental Illness, an estimated 18.1%, nearly 20% of the US adults aged 18 years or older suffer from some type of mental illness. And 4.2% suffer from a seriously debilitating mental illness. And suicide is the second leading cause of death among people aged 10 to 34. So this is really, in its own way, it is an epidemic. And it's not just a disease that afflicts just one person. Mental illness is a disease that has really an emotional weight that attaches itself to partners and to families. And so, unlike other ailments that are kind of more physically obvious, this ailment is more silent. And so I'm really excited today because we're going to chat with a group of panelists who've developed products and technologies that are specifically targeted to increase wellness and also improve mental health and well-being. So I wanted to also highlight the diversity of this panel. For a lot of mental health panels, there's usually folks in either, the Western or Eastern world. But I'm really excited that I've selected a really group of diverse folks who are targeting this from very different lenses and perspectives. Because the wellness, in my opinion, means not just the physical, but also the emotional and spiritual wellness. And there's a lot of different modalities for a lot of different scenarios. One thing to just stay aware of is that we're going to be offering some discounts from Lucid Lane and also MindRise for folks who want to stay until the end. So, so just a heads up on that. And then I know that we're all battling Zoom fatigue, so I'm going to be really conscious about time. And so I think the most that we would go for is, 40 minutes or so talking, maybe even less than that, and then leave enough time for Q&A so that you guys can all ask your questions. So without further ado, I'm going to introduce my panel. We have Ahmed, Zaafran. He is and by the way, I asked my panel to share something a little bit more personal about themselves, just so you can kind of get a window into their personal life as well as their professional life. So Ahmed Zaafran is a dad of 4. He has an Egyptian background. He thought he might become a musician one day. His fun fact is that he represented Egypt and USA at the 2002 Olympic Games as a trumpeter with the Utah Youth Symphony Orchestra. He's an aspiring chef of Texas-style beef brisket, and he's trying to end dependence on medications while giving back empowering tools to live his best life. And then next we have Dina Burkitbayeva. You can tell me if I mispronounced that. She's born and raised in Kazakhstan and spent most of her life between US and the UK, and she currently lives in San Francisco. Dina is passionate about supporting those who are bringing effective solutions to treat mental health and achieve better mental and spiritual well-being. And the message she really wants to bring to the world is that there are other ways to treat mental health and achieve well-being other than medication. So super interested to hear from her on that. And one fun fact is that she has an adorable Labradoodle named Magic and loves to ski and sing. And then last but not least, we have Tiffany Joy Basse, and she is a serial technology entrepreneur, well-being expert. She's the co-founder and co-CEO of the health, wellness, and well-being technology company MindRise. And MindRise, for those of you who have not checked it out, it's a live streaming virtual classroom and mobile app. And their technology platform helps experts create, distribute, and promote daily bite-sized content. Fun fact about Tiffany, and so I know Tiffany personally, so you can chime in if you want to add anything else. But she's also the former CEO and founder of Ms. Money, so a very well known person in the Valley, and has a really interesting entrepreneurial background. So I'm very excited to welcome you all and dive into the conversation. But before I dive in, just wanted to make sure I got your backgrounds correct. If there's anything else you'd like to add before we dive in and talk about mental health.
I do have an adorable Yorkshire Terrier called Omi. However, the universe gets you what you need, and he is not very Omi. In fact, my children think that we should rename him Red Bull.
That's awesome.
Yeah. And he dances with me every single morning. So how I create structure in my day is I wake up, I have a Zoom class with my dance community, which is kind of like part dance, part yoga. And he dances with me. He asks for me to pick him up, and we dance together in the morning from 9 to 10 every morning.
Oh, so cute. Great. So we'll just dive right in. And I want to first start by talking about just the general state of mental health in the US and even globally, and why this is such an important topic to discuss at our time. And I think, for the folks who probably have more information and stats that they could share, or resources that they could share, but I'll kind of open it up to the group, and really would love to hear from you what you kind of consider as the general state of mental health right now in America, and what we should be thinking about right now.
Well, I'm happy to kick it off. In fact, I just wrote an article about how the mental state globally, not just in America, how we're at where we're at is because of brain science. So right now there's an overwhelming amount of emotions based on anger and fear and unknown. And what happens with mental health is that your brain is neuroplastic, which means you may have been going along with a nice peaceful life, and all of a sudden something comes and hits it like a pandemic, and you start to rely on your more prehistoric limbic system and your amygdala, where the fight, flight, or fear, flight, fright, or freeze response are. And what happens, it feeds on itself. It's very hard. It's much harder to have rational thought and to make decisions and plan your life when you're in this crisis of fear and anger. And we're seeing mental health call lines. There's a government call line for mental health that's up 1,000% since the start of the pandemic. And we're not seeing enough government support for mental health programs, so people don't know where to go for help. Until recently, therapists weren't even allowed to treat patients on the phone, and things are spiraling a bit out of control. But I do have hope. I think there's hope in the long run.
Awesome. I mean, I think it's no surprise, and we're seeing the appalling statistics all over the place. So I won't kind of go and repeat those. I think what's been very interesting to me about the state of mental health right now is I've seen a really big shift over the last few years of questioning the status quo by the people who are struggling, and the millennials especially, right? So if the sort of the traditional way to get treatment for mental health was you go to your GP or your psychiatrist, and they give you a prescription for an antidepressant. If that one doesn't work, they give you another one and another one. And I think what we've seen recently is that people are taking their mental health into their own hands, and they're willing to question that this is actually the right way to get treatment. And they're going and actually finding their own ways to heal themselves, right? The journey to that might not be sort of, I'm not feeling well, and I go and I find something that works for me that is not antidepressant and traditional psychotherapy. It could be having tried that. But just the general trend that I've seen, and it's very encouraging, that people are actually driving the innovation in the mental health space because they're willing to say, I might not want to take antidepressants, and maybe traditional psychotherapy is not working for me alone. And so we're just seeing that people are going and sort of finding the information and connecting with different modalities. And I think that's just been incredible. And that's what's been driving most of the innovation in the alternative treatments. And what I mean by that is not sort of psychiatry, medication, and traditional talk therapy. And I think with COVID-19 and seeing how all of that's accelerating, that's, you know, I've seen the companies that I've either invested in and have been looking at is that they're really ramping up because they're seeing a much increased need for the alternatives that's come out of all this. So it's been really great to see that.
Yeah, we really need to see that mental health has to come to the foreground in all its considerations and complexities. There's been so much focus on the spread of the virus and not a lot on the spread of mental illness, which can have very difficult and far-reaching effects.
Right. Right. Thank you. And Ahmed, do you have anything else you want to add to this question, or?
Yeah. You know, thank you for having me and inviting me to this great panel. And, you know, to echo what they both have said, you know, coming from a physician's perspective and, you know, what we're seeing kind of on the front lines and mental health in general, you know, we have to remember that this pandemic is being, you know, kind of built upon an already existing epidemic in the opioid space and in the benzodiazepine space. And that is also coinciding with the fact that people are starting to become more comfortable in their vulnerability. You see, you know, the millennials and being on Instagram and being more open-minded about, you know, what mental health means to them and what kind of coping mechanisms that they're utilizing. And so, you know, I think there's more awareness and understanding that, yeah, we don't have to use these traditional antipsychotic or antidepressant type medications. You know, people don't have to lean upon, you know, benzodiazepines or opioids to numb the pain or something to not even comprehensively treat the pain. And what we end up finding out is that there are so many additional, you know, non-pharmacologic modalities out there, like cognitive behavior therapy and mindfulness and psychotherapy that, you know, in conjunction with, you know, evidence-based medicine, and those are actually evidence-based modalities that have been shown to treat acute and chronic pain, have been shown to do, you know, dramatic improvements in areas of anxiety and sleeplessness and whatnot. But as a society, I think that we're moving in a positive direction where the stigma is slowly becoming eroded in time. And that's being met with, I think, a professional or medical professional movement towards mind-body therapy and awareness and incorporating these practices in our day-to-day operations in a way that allows for people to show strength in that vulnerability and for care to be delivered in a compassionate and empathetic, with empathy. And so, you know, the problem is still very prevalent, but whereas the conversation may have been, let's kind of sweep it under the rug and deal with it, you know, secondarily to the common chronic illnesses like diabetes and hypertension and heart failure, it's coming to the forefront and saying, well, maybe all of these things are tangled in a web of comorbidities that if we address, you know, mental health and substance use disorders and even accidental dependence, that actually can have an impact on their other areas of their life. And so, you know, I'm very optimistic about the direction we're moving as a society, and from the medical aspect of it, also that, you know, physicians and healthcare providers are becoming more open-minded in terms of the tools that we can use to combat mental health and meet people where they are.
Excellent. Yeah, it makes sense. And the idea that we're in this interconnected system, I think, is something that is very much coming to the forefront. I'm curious, you know, digging into that, if there are any demographic trends that you guys are seeing from, you know, because we moved from a space of talking about mental health was a taboo to now it being more mainstream and accepted. I'm curious if there are maybe different demographics that are more open to speaking to that, and just sort of trends that you may have seen, if any. And if not, we can skip this question too, but I'm just curious.
I think in terms of statistics, I can't think of any off the top of my head. But I think just from what I'm seeing, and I think I've read about this as well, is that the millennial population is who's really driving the sort of the openness, like Ahmed has mentioned, and the fact that they're just willing to try new things and question the traditional modalities.
Yeah. Great. And have you guys seen any sort of significant change from the COVID-19 response over the last couple of months? I mean, I know there's a New York Times article that came out about the rise of suicides from nurses and doctors, and a couple other articles kind of similar to that. Just curious if that's been something that's affected your, for Dina, for the companies that you've invested in, for Ahmed and Tiffany, maybe the rise in patient care, and then we'll get into what your company actually does after this. But I think it's just important to kind of talk about the state of where we're in from COVID-19 and how that's impacted your business.
I think when it comes
go
to,
ahead.
do you want to go? I think when it comes to those of us in the health and wellness apps that have meditation and mindfulness and wisdom talks, that we've seen a rise in usage and a rise of new subscribers because people are desperate for help. You talked a little bit about demographics in your last question. Think about certain groups of people like health workers. I mean, it's really suggested that health workers who now have their shifts sometimes doubled or tripled need to take a whole block of time completely away from the front line so they can reset their nervous system and calm. And so, for example, someone like MindRise, we give them unlimited free access for a lifetime to all front healthcare workers so that they can find ways to, well, really decompress and get in touch with their center, like the original meditation that I did.
Great. And
I mean, I think,
Okay.
Go ahead, Dina.
In terms of the companies that I've invested in, there's not really much to say about them because the product's not yet through the FDA and available for treatment. But what I do in my company is we track Google keywords, right? So the volumes at which people are searching for mental health and mental wellness related keywords. And what we've seen sort of an increase across the board, but I think on average about 20 to 25% in volume for sort of, looking for either sort of like I need help type of queries, as well as sort of for the specific type of treatments that, people already know what treatment they want, so they're searching for that. So I've definitely seen an uptick there.
Yeah, the beginning of the question, Yasmeen, you had mentioned, some of the statistics in the Times and, people in healthcare on the front lines with the COVID-19 epidemic. And I think we all heard about the nurse in New York City who had committed suicide as a result of what she had experienced and seen. And personally, being an anesthesiologist, my day-to-day life, has a lot to do with, placing breathing tubes on people who go into respiratory failure. And obviously that was kind of like that is the riskiest procedure, intubation in the COVID-19 era. So, all those pictures of people getting in, PPE and hazmat suits and all of that kind of stuff, that's kind of my reality. And what I found from my colleagues and from myself is that, there needs to be a better pop-off valve for that stress and that anxiety. Are you going to become infected? If you are infected, are you going to, pass it on to your loved ones? Will you get sick, while you're on duty? And so this is something that I think is going to have residual effects, for frontline and healthcare workers moving forward. And so we need to have the appropriate, clinical programs, but also the technologies to enable that at scale. And I know we're going to talk about, what individual, what different technologies are going on out there with the different companies. But I do have some statistics. The American Psychiatric Association actually sponsored a survey online, and they found some really compelling data from the people who they interviewed. 19% in the COVID-19 era are experiencing having additional trouble sleeping. There's been an 8% increase in people who are consuming alcohol and drugs or substances. 12% have been saying they've been fighting more with their partner or loved ones because they've been stuck at home together, and too much I guess confined spaces can spark some arguments. And 24% ended up saying that they had trouble concentrating on other things because they can't stop thinking about the coronavirus. And so, when you think about folks who, in addition to just the baseline nervousness and the baseline, anxiety that comes with the uncertainty of a pandemic like this, there are people who need to go to the hospital for basic, for things that they were going to the hospital for before, whether it's for elective surgeries, whether it's for chemotherapy. People are getting diagnosed with cancer and they're already immunocompromised, yet they have to go to the hospital, where they're more at risk of capturing or getting infected with COVID-19. So all of this is playing into each other, and the numbers are showing that all of these mental health and all of these factors are increasing in this COVID-19 era. And I'm just excited to be a part of, the solution moving forward.
Yeah, great. And I think for the group, I know that you guys can look up where our panelists are working and what their products are, but because we're going to be diving into more product questions, I'd love Ahmed, Tiffany, and Dina for you guys to just give a quick bio or a quick kind of run through of your technologies and the products. Dina, for you, the products that you've invested in. And then for Tiffany and Ahmed, maybe you could talk to us about why you decided to build your company and why you thought it was important at this particular kind of trajectory.
Well, I'll start. Part of the reason I decided to start MindRise is I had started a company called Ms. Money, which educate women and girls on personal finance and financial empowerment. And that has reached millions of people over the year. And what I came to realize, coaching women or just providing resources for them, is you can have all the money in the world and the financial stability, but if you don't have health and wellness, it's really all meaningless. That it is so important. I look at it kind of like a triangle. So money is one corner of that triangle. Joy, happiness, that's one. And then health and well-being. And my goal then was to start filling in that triangle. I already covered the money part. So now how can I help people have more joy in their lives, more peace and calm, and overall health and vitality? And so it's been my mission. It's a project I've been working on for years. And I know you had asked, how has the product line shifted? So I'll talk about that too. But we started just by releasing a handful of meditations to help people settle and get to a state of equanimity and just allow their nervous systems to diffuse. We then grown to hundreds of other music tracks and stories to help people sleep. Ahmed had said, 18% more people are having trouble sleeping. Yeah, I was one of those in the beginning. So I completely understand that. So we're helping people sleep. We're helping them calm. We have nature sounds and beautiful music tracks, including things like binaural beats that are proven to help calm your brain waves. There's scientific research behind this. And we've also come out with some kind of fun and playful features, right? So if you're in the mental health space like we are, like MindRise is, you want to have a little levity, because if things are just always heavy and serious, people are less likely to show up and use your app every day unless you add some, spark some joy in there. So we release things like Earth Wisdom cards where people can draw a random card and get a nice little positive reading for the day that will then recommend what meditations and music and stories to listen to. And we do the same thing with astrology. 90% of people know their astrological sign, so we come out with a weekly reading for that. how we've shifted, and I think this is really important. Being a lifetime entrepreneur, this is my 5th company. I'm always looking at global trends. I saw COVID coming a month before it came, before lockdown came. As such, I was able to prepare from a much safer point of view and alert my family. So I've been mostly calm for it because I had the anxiety before a lot happened. And so how we decided to shift MindRise is to build a platform of video conferencing because now everything is taken out of the personal realm. My yoga classes, my dance classes, my retreats for my Sangha, like everything, every single teacher that I used to follow in the well-being space, now I have to see them on some video conferencing platform. So we decided, since we're in the wellness space, there's no platform that is just for well-being teachers. So we've built our own. We already have a beta going. In fact, we were almost close to hosting this on here, but we have a few more weeks for that. And it allowed teachers to connect in more novel ways. Zoom is a little limited. I won't go into the features we have. Let's just say there's a lot more exciting new features that will be beneficial for the participants and the teacher and will help reduce that Zoom fatigue. I just wrote a great article on Zoom fatigue on LinkedIn, and I have 12 great ways on if you have to do a lot of video conferencing, here are 12 ways to reduce some of that fatigue and stress that comes along with it.
Excellent. Thank you so much, Tiffany. And I think you're like a walking advertisement for your product because every time you talk, it's very deeply relaxing. I think I agree. Okay, Ahmed and Dina, do you want to speak to the same question? Do you want me to repeat the question in case you forgot, but just why you decided to build your company and how your product mix has shifted?
Sure. So my company is called Lucid Lane, and I'm the Chief Medical Officer and co-founder of Lucid Lane. And about 1.5 years ago, we decided to build a comprehensive tech-enabled solution. And that solution is focusing on treating medication dependency, prevention, and prevention of substance use disorders. And we do that utilizing kind of data-driven measurement and monitoring, personalization of clinical treatment programs and protocols, and then timely interventions based on those health signals that we continuously measure and monitor, and a tapering strategy for patients or clients who are interested and eager to slowly come off of habit-forming medications such as opioids and benzodiazepines. We combine these medication tapering strategies with behavioral health coaching. Everybody who goes through our programs utilizes telemedicine or telehealth. All of it is done remotely. And they're paired one-on-one with a personalized health coach who's actually a certified therapist. And in collaboration with any of their prescribing physicians, or if they're working on this on their own, we basically pair the two worlds of behavioral health interventions along with these health signals that we collect. And these health signals have to do with anxiety, depression, sleeplessness, all of these kind of health signals that we've been discussing in terms of mental wellness, but doing it in real time in a way where the individual gets care tailored to where they're at and what those signals are telling us, and then pairing them with in the moment interventions combined with those signals, so that now as they go through the different programs, they get something very unique and specific to their needs. A lot of times people are struggling with accidental dependence issues where for the first time in their lives, they might be going in for surgery, have never been exposed to an opioid or a benzodiazepine. And because sometimes, doctors don't have the experience or the expertise to help them come off of those medications in a timely manner after their procedure or their surgery, unfortunately, they become dependent on these medications and are on them for many years after. And so while their pain or their acute or chronic pain or their underlying diagnosis is now resolved, now they have a new diagnosis or they have a new issue of dependence on, on these types of medications. And to come off of them safely requires a very specific, nuanced program that does so in a very controlled way. So we marry those two worlds together. We're in 35 states right now and growing. You know, we've been able to grow extensively over the past year, and right now we're focusing on people who are actually, you know, dealing with the COVID-19 pandemic on top of this opioid and benzo epidemic. And so we've expanded, you know, to answer the second part of the question, we've expanded to opening up our services to anybody out there who might be at home silently, you know, with anxiety and depression and uncertainty, whether they have, whether on these medications or not. Everybody could use some therapy, and to be able to do that from the comfort of their home, where they don't have to necessarily be waiting, you know, in a doctor's office or a therapy office. It allows them to kind of be more vulnerable and yet still have that personalized intervention.
Wonderful. Thanks, Ahmed. And is this the sort of, you know, your focus on opioid and benzo and then moving to COVID-19 kind of mental health and anxiety response, is that going to kind of continue indefinitely, or is that just here for a couple months? I'm just curious if you've added that to your product roadmap or.
Yeah, so it's I don't think COVID-19 is going anywhere in the next, you know, year or so, and I think the residual effects of what's been going on with COVID-19 is going to have a profound impact on our global society for many, many years to come. So, you know, I think this is going to be embedded into what we do, into the culture of the company. And, you know, I think part of it is acceptance. You know, we have to understand that this is kind of our new reality. What is it going to look like when people start going out into the world again? How is it going to be when we start interacting with each other? How are these frontline workers going to deal with post-traumatic stress disorder? So, you know, I think it's the reality moving forward. We've expanded and you know, incorporated this into our clinical programs. All of our therapists are utilizing, you know, coping mechanisms that I think are broad in scope, but also personalized and tailored for what they need. And I think that's just going to be the norm moving forward. And I also think that a lot of this is going to be done remotely because of that. So telemedicine or telehealth and you know, utilizing, you know, the things that Dina and Tiffany have been talking about. You know, we're going to be doing a lot of this remotely and trying to reach people and helping their mental health from that standpoint. Yeah.
Great, excellent. Glad to hear. And Dina, do you want to talk briefly about ATAI and the investments that you made?
Sure. So the investments sort of, I look at mental health in general, but the investments to date have been sort of focused on primarily two things. It's been biotech and media in the psychedelic assisted therapy space. And I also run my own company, which is media in the mental health space. But let's just focus on the investments. I've made an investment in ATAI Life Sciences, which is sort of a biotech platform for biotech companies as well as data-driven companies to run clinical trials and bring various molecules. Some are sort of psychedelic type molecules as well as non-psychoactive molecules through the FDA for various mental health conditions. So one of the sort of more prominent companies is Compass Pathways. It's been in the news a lot. They're in, so it's a biotech company that has developed a synthetic molecule of psilocybin. And the reason why it's synthetic is because that's what is needed for it to come through the FDA to be approved for medical use. So psilocybin as an organic cannot be taken through the FDA for medical use. And they've done really well. They've gotten breakthrough therapy in 2018, which means that the FDA has a lot of sort of optimism for the science, for what it can do, and it's supporting them in a large way to be able to go through the FDA much quicker. So they're currently in phase 2B, and a company like this, if everything goes well in 2022, once they've been, kind of approved and cleared through the FDA, is they will be able to administer this to people who have treatment-resistant depression. And so the statistics say that about a third of all people who have depression are treatment-resistant, which means they cannot get treatment, they cannot get treated through medication and or therapy. And so for a lot of people who are struggling with depression, they're taking multiple antidepressants, they're just not getting the relief. And it's a huge number. It's around 100 million of diagnosed patients across the world that are currently cannot find any treatment. And so this is what Compass Pathways is building, and it has shown very significant efficacy and safety. I don't know if a lot of you know, psilocybin sort of has been used in rituals and ceremonies by for hundreds of years by various tribes around the world, exactly. So, but they're kind of taking that and bringing it to Western medicine. And so there's about 8 companies that have made investments in the biotech space, and a media company called The Third Wave, which is all around educating people about what are psychedelics and how they can be used for mental wellness. And the reason why I've invested is obviously the impact that we can make. And I think, the conditions that they're going after, which is PTSD, anxiety, treatment-resistant depressions, are huge. And a lot of these molecules have been, already used and have shown efficacy and safety on humans. So they're quite farther along in the clinical trial path. And they just hold a lot of promise. And all of these companies also have very strong teams, which I've been sort of, both on the clinical and business side, have been very impressed with, and just really excited for them to come to market. Obviously, the FDA takes a very long time. Compass Pathways being the one which is farthest along in this pathway, is about 2 years out, unless the FDA deems that something like this needs to come to market faster. But clinical trials still take time, so we're still about 5 to 7 years out from seeing sort of more of these molecules available for treatment.
Great, thank you, Dina. So I'm just going to ask a couple more questions, and then we can open it up to Q&A. And I'm sure you guys probably have questions, so maybe you can start to, I don't know if you have access to add them into a chat, but if not, we'll just open it up for questions. But I have 2 more questions for the group before we move on for that Q&A. I'd love to hear, I think like personal stories are really important to kind of ground us in the products that you guys have built or invested in. And so, and I know, Dina, yours is still, hasn't passed FDA, but if maybe you could speak to another example of a product that you've worked on that has impacted a customer or someone positively. And so I kind of just open it up to Ahmed, Tiffany, and Dina to talk about a story or, an example that you've had where there's been a major positive impact from your product. Whether it's a testimonial or whether you kind of just ground us into a story, that would be great.
Yeah. I'll lead with that. So being an app in the App Store, we get hundreds and hundreds of reviews of people telling us how great we are. So that really allows me to wake up every morning and be positive and keep trudging along as an entrepreneur. But one in particular stands out because obviously we're not the only solution for sleep. You could take a sleep aid. You could drink alcohol. You could go for a run. There's lots of other apps that help you sleep, but we've had many, many people, and one person in particular just wrote this to us a couple months ago, and they said they had tried everything to get to sleep, and different apps, medicine, and nothing worked. But they said there was something about our app and our meditations, and gave them the ability to create their own soundscape. So they could have, you know, a little bit of waves and maybe also a stream and some birds or the sound of seagulls. We have dozens of sounds for them to pick. So they love the fact that they could really customize their whole sleep experience and either play a meditation or play one of our 100 different sleep stories. And they say they were asleep like in 5 to 10 minutes every night. And as long as they're using our product, it's become easier and easier for them to go to sleep as they retrain their brain. And so I feel pretty proud that we've created something that can solve such a huge global crisis, such as insomnia and stressful sleep.
Thanks, Tiffany.
Dina, you want to go, or should I go next?
Sure, I can go. So I guess in line with this, I support kind of a few nonprofit organizations, and one of them is called Vets Inc., and it's basically is a nonprofit organization to help Navy SEALs who struggle with PTSD primarily from combat, to get psychedelic assisted therapy to address their mental health issues. And I think I've heard a ton of different stories, but I think just the overarching statistic has been amazing. So the Navy SEALs, I think there's been 150 so far that have gone to Costa Rica, where it's legal to get psychedelic assisted therapy. It's not in the US, except for ketamine. They go there for a 5-day retreat, and all of them have PTSD alongside a variety of different mental health conditions. And after they come back from those 5 days, after 2 months, when they go and they, are, getting diagnosed, 86% are no longer meeting the conditions for PTSD, right? So it's, I think, when you're speaking with people whose whole lives have been completely changed, and it's not only them, but it's also their wives and their children and those that they love are also developing mental health conditions and PTSD because they have someone who's struggling so much. You see something like that, and you just get really sort of touched by the benefits that this can have.
Beautiful. Thank you, Dina. And Ahmed, anything to share before we move on?
Yeah, there's one client that comes to mind, and he had been diagnosed with a rare form of cancer, and was really struggling with the diagnosis, as well as kind of the pain that was superimposed with the chemotherapy and the radiation involved. So he jumped in our programs, and we worked with him from the point of diagnosis until the point of remission. And so there were many tiers of assistance, and being able to hold his hand every step of the way, via daily communication, via texting, via, audio and video psychotherapy sessions. We were able to kind of help him, in a comprehensive way. From a pain standpoint, his pain scores came down significantly. And there's a, we think about the data and allowing the data to kind of drive the empathy and the compassion. Well, one of the things that he was really struggling with is something that we call pain catastrophizing. And pain catastrophizing is basically how our minds wrap around, the idea of pain and what that means, and how we cope with it, and how sometimes it can consume our minds and our thoughts. And when you look at, how his journey from the beginning of being diagnosed to overcoming and defeating cancer, and, what that meant for his journey is his pain catastrophizing improved dramatically. His emotional well-being improved dramatically. His quality of life improved dramatically. And we know that because we monitor it, and we that's part and parcel to what we do at Lucid Lane. But also we look at their functional status, and he was at a point where he couldn't even comb his hair in the morning because of the depression and the anxiety. And, you know, towards the end of working with us, he wasn't ashamed of his diagnosis. He didn't feel, you know, marginalized or isolated, and he went back to work and lived, you know, his best life. So, you know, it's those kinds of stories that really, you know, empower us and keep us going. And, you know, we hope to take, you know, certain, you know, stories like that and extrapolate that and extend it to everybody who goes through Lucid Lane.
Wow, thank you, Ahmed. That was very touching. It just, you know, it's interesting when you guys talk about these stories. We're no longer in this like zero-sum game if we ever were in one. And I think the idea is more clear now than ever with COVID-19 that we're so interconnected, and you know, healing one person, helping one person actually helps all of us. Like we all rise together or fall together. So the way of you know, that approach to me kind of makes all work in this space really worth it. So thank you for telling that story. One last question is, I'm curious what you guys think the future looks like in the wellness and mental health space, and what do you expect to see moving forward? You know, Dina, I know you mentioned that in 5 to 7 years, you'd see a lot more of these sort of psychedelic companies come to market. But I'm just curious, you know, let's say it's 2020, 2030, or maybe that's too far. Maybe we have no idea what's actually going to happen in a few months, but let's say 2025, what do you predict, or what's your sort of thesis on where people are, what people need from a mental health and wellness perspective?
Well, what COVID has done for us is allow us alternative ways to get together and receive therapy. And the fact that we're doing this Zoom call and video conferencing now, everybody is getting on video conferencing that had never been on it, wasn't aware of it. Even if they were older, they weren't on it. All the kids are on it. Everybody now is using it as a primary tool. What that means is that the cost of healthcare can drop, right? Because you can even do broadcast healthcare meetings where you have 20 people in the room. You could have a sense of anonymity, or you could do group therapy where everyone knows each other and there's not anonymity. So I think there's going to be, it's going to be less expensive. It's going to be more accessible. And I think when it comes more to my field, which isn't medical, but more wellness, you're going to see people who might have never thought of themselves as having a public speaking platform, whether that's doctors or wellness professionals or experts. Now the tools are going to be so easy to use, and they've probably already been experimenting with that we'll have some really bright minds getting their gifts out to the world that are going to be accessible to everybody. If you have 1,000 people on a call versus 10, the amount that you can charge can be, you know, significantly less. So I see that as opening up and overall raising global wellness.
Great.
Yeah.
So yeah, accessibility definitely is going to increase significantly. And thank you for that. Ahmed and Dina?
I can go. I think I kind of see 3 things that I would be very excited about. I think 2025, I think more of these sort of, if we're saying focus on kind of psychedelic assisted therapy, we're going to see more molecules that are going to be available for treatment. So, you know, I think it's expected that MDMA will be available for PTSD in 2021. And, you know, the conditions that that MDMA can be used for are pretty much all of them. And studies are going on right now to test MDMA for the various conditions. So by 2025, I can see that MDMA is going to be available for various mental health conditions. Hopefully 2022 in psilocybin, you know, and the other molecules such as ibogaine, ayahuasca, LSD are all in some sort of trials at the moment. And, you know, hopefully more of these are going to be available for treatment if they're right for people. I'm not saying they would be right for everybody, but it's always great to have these options. I think in 2030, what I would be very excited to see is personalized medicine, you know, sort of the way I see it as a, as a graph, right? So, if I were to come in and I were to get a full scan of my physical, genetic, mental well-being, and just all the markers, right, sort of on the one axis, and the various conditions that I could, have that are specific to me, to my biological and genetic make, and would be able to get a very personalized molecule. So it wouldn't just be, psilocybin COMP360, which is being developed now by Compass Pathways, and, would be given to every single patient, right, who would go through this. It would actually become a COMP360 Dina, right? And they would know, whether Dina wants a psychoactive experience or actually she's not, meant to have a psychoactive one, and it should be a shorter acting or longer acting. And, maybe there's different ways to sort of create her experience, across the board. So I think personalized medicine is definitely where we're moving towards, and hopefully in 10 years time, it's a reality for people, for most people. And I think the other thing that I'm seeing already picking up, and I really hope to see as it grows, is that there's going to be more therapists and more healers out there. I think I've seen this as a problem for Compass Pathways. So if Compass goes through and is approved in the UK, to be able to treat all of the treatment-resistant people, that would basically take up all the therapists that there are in the UK. So there's a huge shortage of therapists. And, I think mental health is one of these things that can scale to a certain extent, but the human touch is still so important that I think the next kind of big thing in mental health is that we don't have enough therapists. And hopefully more people are going to start training, either for, traditional clinical psychotherapy or other healing modalities. So I think this is something that I see happening and really hope to see as well.
Very interesting. Thank you, Dina.
Yeah, Dina, I agree with everything that you're saying, and I also see the future of medicine in a very similar light, particularly in terms of personalized and precision-based targeted therapies in medicine. I can already tell you that some of my colleagues at Stanford are already working on that. They're and implementing that, particularly looking at patients who are going for total joint surgery, orthopedic surgery. They can do immunoanalysis and look at what their immune response is prior to surgery. And then based on that, tailor an anesthetic intraoperatively and pain regimen that works specific for that individual. I think that's, the future of medicine, and critical to move in that direction so that people get what works for them. We're all so unique and different. Most of the studies that we do are based on populations, and if we can start utilizing targeted based methodologies and medications or whatever it might be, that's a big step forward. I also want to echo your point about therapists. Therapy is the backbone of what we do at Lucid Lane, and it's that human touch that our therapists provide for our clients on a day-to-day basis, that I think is going to be the blessing, but also the challenge moving forward into the future. How do you take, a very warm, human, compassionate, empathetic person and scale that? And so I think, leveraging technology, particularly in artificial intelligence and machine learning space, to be able to, leverage data in a way that serves as an extension to that human element, not taking that human element away, but actually using it as an extension to be able to reach, millions of people, whereas in the past or today, you can only reach a certain finite amount, is something very exciting for me, and where I see us going as a society. And then just lastly, I think that this pandemic has forced us to innovate. And it's forced us to realize that we don't have all the answers, whether it's in, you know, medicine or in politics or economics, and how, you know, dependent we are on each other. So I think legislation will change. I think a lot of the restrictions and barriers will change. Some of the things that would have taken us 2.5 years to get, you know, through the regulatory phase has taken us 30 days for final approval. And so that is our reality on the ground now. The key is, what can we do, or what are we going to do with that freedom to innovate and to take it to the next step? So I think the challenge is, you know, it's easy to throw technology at problems. I don't think that that will work with mental health. I think we're going to have to figure out ways to utilize these molecular interventions like Dina's been talking about, utilize these mind-body therapies that Tiffany has been talking about, and integrating them with technological, you know, tools that serve as an extension of the ingredients, the fundamental ingredients of what helps with mental health, and that's empathy, compassion, reliability, relatability. And so I'm hopeful for that kind of a future.
Yeah, thank you so much to the panelists. We're going to open it up to some Q&A, but before that, I just wanted to kind of announce some discounts that we have from some of our panelists. They've generously offered these, so this is great. I don't have a chat box, but I'm just going to, and I can ask the Techwadi team to send an email with some of these discounts, but Lucid Lane has offered a month free, 4 free sessions at a basic level. If you go to their website, it's lucidlane.com, and then /get started, and then you can just mention the Techwadi promotion. We'll send an email with all this information as well. And then for MindRise, I'll have to send an email because there's a special link, but it's an opportunity to lock in MindRise for only $40 a year, which is
they can also just download the app and sign up and go to the contact us page and mention Techwadi, and we can give it to them that way too.
Great, Tiffany. Thank you. And Dina, we have, no, I'm just kidding. I was going to say.
Dina's offering funding for all the.
free psilocybin, guys.
No. But yeah, let's open it up for just, I'm going to be respectful of time because we wanted this to just be 75 minutes, you know, so leave it like 5 to 7 minutes of questions, and who knows, maybe we don't have any questions, but I'll just open it up to the group. We have such an incredible diverse panel. I'm even more fascinated in all the things that you guys are doing after this talk, and I have so many more follow-up questions, but definitely wanted the Techwadi community to be able to ask questions. So I will open it up, and I think you guys can unmute. I hope you can unmute. Any questions? Don't be shy.
I think Ahmed has a question. He raised his hand. He needs to go.
Hi.
Hi, Ahmed.
Hi, how are you? I'm from Cairo now, so the time is 3 a.m.
Oh, wow.
يا عم الساعة كام دلوقتي هناك؟
الساعة 3 نصحى ونصلي ده.
I asked him, what time is it over there? He says 3 o'clock in the morning.
Wow.
I'm Ahmed Abul Haz from Cairo. I'm a CEO of Shizlong. Shizlong is a first mental health platform in MENA region. We are focusing on Arabic language mental health mental disorders people in the world. We have now 70,000 patients from 70 countries and 350 therapists from 18 countries. Now through COVID-19 in MENA region, we have a big stigma of mental health, and we have a big problem about dealing with emotions and dealing with COVID-19 in Egypt and in MENA region in general. My question is, what is the status after COVID-19? We have a big issue in COVID-19 now about the mental health, but what's COVID-19 after COVID-19 in terms of the symptoms of people in terms of, we have a social distance issue now. We have in terms of lockout and so on. So what's after that? Not in terms of digital mental health, but in terms of the diagnostic of people.
Ahmed and Tiffany, Dina, do you guys want to speak to that?
I don't think I understood the question. Sorry.
I think that, Ahmed, maybe you could correct me if I'm wrong, but I think what you're asking, like what, you know, because there's a multitude, I think, of questions in that question, but one is that, you know, people can't really, it's still a taboo in the Middle East, this idea of mental health. And what's sort of the next step after we emerge out of COVID-19 with mental health, with sort of like next steps? I think are you speaking specifically to your company, or are you just speaking in general about like the state of mental health? Maybe you could be more specific, but and you know, Ahmed, maybe you interpreted it differently or others interpreted it differently, but.
Yes, this is my question actually, yes.
Okay.
Okay, so maybe I'll jump in and go first. So I think, you know, the first thing that you have to do is understand the audience. And the reality is that the audience in the United States, or, you know, is going to be vastly different than the audience in the Middle East and North Africa, because, you know, the different societies and certain values are held in different, you know, with different emphasis and so forth. So I think, you know, the key thing is going to be education and having the capacity to reach people where they're at, and their, you know, their health and their mental state. A lot of it is unknown. You know, we don't really know what the long-term effects of COVID-19 are going to be once everything settles down. We don't know when a vaccine is coming. We don't know when we'll have, you know, solid evidence-based therapeutics for it. You know, we're hoping sooner than later, but the point is that some people will have access to these interventions much sooner than others. And the mental health aspect of it, you know, could linger for decades. And it could be a generational issue. So I think, you know, to answer the question of what's next, I think what's next is being active listeners and understanding what the fundamental underlying issues are with the individuals in that particular region in the Middle East and North Africa, and what it all means within the context of their day-to-day lives. And then using, you know, concrete tools and resources that are adaptable for any ethnicity, any background, you know, as human beings, things that contribute to emotional well-being and quality of life and functional status. At the end of the day, it's the same things that bring us up and put us down. So, you know, I think utilizing those fundamental resources and applying them in a way that is in tune with their background and their ethics and their morals and, you know, the way that they live their lives is the most important thing. You know, we do a lot of talking, and we should be doing a lot better with listening.
Okay, thank you.
Thank you, Ahmed.
Thank you.
We had another hand up from Hossam. Do you want to chime in? Maybe like we'll have one more question after that, or this could be our last one, depending on if there's another hand. But Hossam, you want to jump in?
Sure, thanks, Yasmeen. My name is Hossam, currently at Facebook. Thank you all for your time, super interesting. It's a question for all three of you. Like, how do you measure success for your startups from like a KPI point of view? So, you know, it strikes me that in consumer or general B2B tech, you know, retention is like a key factor. But here, if you guys are all doing a good job, you actually might lose your users over time. So, you know, what does success look like for you guys? How do you look at outcomes, something else? Like, how do you even think about that? Thank you.
I'll chime in from the app's perspective, because everything is so carefully monitored. What you listen to, how long you listen to it, how you rate it, how often you come back. I would say one of our key measurements is to try to get people to come back daily. And unlike something more on the medical side where you're trying to cure an issue, we're always trying to improve your overall wellness. And how we measure success is how often people come back. And that's part of the reason we've focused on products that delight you. Like I said, we had some entertaining products, because if you're not delighted, it's kind of hard to come back and always like do a deep dive into well-being content. And it's part of the reason we've also are launching our video conferencing platform and calling it MindRise Live, so that every single day there will be a dozen things live that people can tune in. And we feel that that's going to increase our daily viewers. And then daily viewers overall translate into a higher subscription rate and more upsells. So that's why they go hand in hand.
Great. Any other?
Ahmed, do you want to go?
I always feel like Dina and I are about to talk at the same time. I just hold my breath.
Ahmed, go ahead.
Thank you for your question, Hussam. I'm actually really geeking out about that question because, you know, KPIs are just absolutely critical for any startup and building a company. And so I think our situation is interesting because we have KPIs that are along, you know, the clinical pathway. And then we have KPIs, you know, along, you know, the business aspect and product and operations and whatnot. So what I'll do is talk a little bit about the clinical aspect and what kind of KPIs we focus on. So one is going to be participation and engagement. When people go through our program, our programs need to be enthralling and engaging enough that people not only are joining in on their weekly sessions, but their day-to-day texting and whatever that might be. And then you need to have month-over-month engagement so that the clinical programs that you initially set them out on that journey, that they're continuing on those programs to the point that they're starting to have positive outcome metrics. And so that kind of leads into, you know, the outcome metrics that we follow. And so we have outcome metrics across emotional well-being, quality of life, functional status, and then also tapering. So for patients who are looking to get off of certain medications, coming off of those medications can be dangerous if you do it too quickly. And so as we work with them and their prescribing physician on tapering these in a systematic, controlled fashion, we're simultaneously measuring KPIs across those outcome metrics that we were talking about. And so over time, you start seeing patterns on how people do. For instance, as they start off with their taper, you find that their outcome metrics improve dramatically. And as things get more challenging and difficult and more behavioral therapies are being infused into the regimen, they taper off and they plateau. And so when that is expected, now we know, okay, at some point, for instance, at 6 months, you should see that rise again. So as we look at it from a macro standpoint, our KPIs are being measured, you know, month over month, year over year. But at the micro scale, when you're collecting data in real time, we're also looking at how are they doing from a day-to-day standpoint. And then the third thing is that because we're you know, quote unquote disruptive, right, to the status quo, right? Yeah, I know Hussam would like that. What we want to do is we want to be able to show the institutions, the major institutions out there, that what we're doing is efficacious. So, you know, right now we're in studies with, you know, MD Anderson Cancer Center in Texas, with Stanford University, with the Palo Alto VA and beyond. And what are we trying to accomplish with that? We're trying to show efficacy, that our programs are not only beneficial to clients and patients who are going in for surgery or sitting at home silently suffering because of, you know, debilitating anxiety, whatever it might be, but having that captured data and those KPIs indicate that from a clinical standpoint, that what we do, it has a scalability, not just from operations and product and whatnot, what we think about in technology, but from a clinical standpoint, so that when anybody goes through these interventions, or anybody who has, a new diagnosis of cancer, that the holy grail of, digital health is that what you do becomes the standard of care. So, taking all of that into account, it's a daily grind of monitoring, measuring, and implementing all of the different modalities as you build that clinical, digital platform.
Awesome. I think I'll just briefly say, so with the sort of psychedelic assisted therapy biotech companies, it's all about patient outcomes, right? And they're very strict protocols that will be approved by the FDA. So it's not a sort of thing, if the protocol is 4 sessions and X many hours with a therapist, that's what the protocol is. And so I think it's sort of not the similar problem of trying to keep the patient or the customer with you for as long as possible, because it's just a lot more regulated. I don't know what the exact outcomes that will be decided, but it's all about patient outcomes. It's like, where are you right after you've had session 1, session 2, session 4? Where are you 2 months from then? Where are you 6 months from then? Where are you 2 years from then? And I think the biggest thing in trying to improve what these metrics are, and just to ensure that the patients can get the best benefit from having gone through these protocols, is creating sort of what happens after this. Or are they partnering to ensure that people have the support once they leave the program? Because I think integration is just such a big part of the treatment itself, but it's very difficult to sort of create that in a medical space, and integration with a therapist or creating a community that is supportive of you is something that these companies are thinking a lot about, because that would make all the difference to the outcomes.
Great. Thank you. And we have, I know that we've reached 6:15, so we should technically end, but we had one more question, so I'll leave it to panelists. You want to stick around for just 1 or 2 more minutes?
Sure.
Yeah,
Okay.
I'm happy to stay.
Okay.
Absolutely.
Great. Sarah, do you want to, I think you had your hand up if you still want to ask a question.
Yes, thanks, Yasmeen. And I guess, first, thanks to the panelists. And if this is something that's better addressed, perhaps through some links that are shared, along with the discount offers that Yasmeen mentioned, that's okay. Just by way of brief introduction, I'm one of the early pioneers of mobile health, and in working in health system strengthening, and was working in Tanzania, seconded by the president of Tanzania to the Ministry of Health in rolling out their mHealth solutions. Unfortunately, I had a rather traumatic event at that time and recognized that I should probably get some mental health support. And the US Embassy got back to me and they said, well, actually, there's not a single recognized psychologist or psychiatrist in the country. And even working in the Ministry of Health and Social Welfare, recognizing that mental health at that time wasn't actually a recognized form of health. And so I guess my question, there's a few parts, so answer any or none as you like. But one question is just related to the advocacy, and to what extent you could recommend organizations that we can get behind as individuals, or organizations that want to promote broader awareness around mental health as a form of mental health, on the, removing the stigma, for example. And I understand celebrities are coming forward with their lived experiences, but how do we bring this, actually out to the public, globally? And then related to that, from a scalability standpoint, I understand that Ahmed, I think it was you just mentioning, on the scalability with the tech side. But I was curious, I'm in an executive MBA program currently in the UK, and wanting to understand where we see some potential traction from business models, or at least some sustainable funding models that those of us, again, interested and concerned and wanting to bring this to to the public in a big way, where we might look. And again, if there's certain websites we should look at or donor bases, anything like that. Again, I just appreciate any resources, because my personal vision is like Arnold Schwarzenegger. He was made fun of in the 70s when he said, you know, we're going to bring, you know, bodybuilding to the mainstream, and everyone told him he was crazy. And, you know, now we have, you know, by every, you know, roadside hotel, you know, there's going to be an expectation of at least a, you know, rowing machine or a little, you know, core machine or some sort. So, you know, anything you can suggest for how we take advantage from an advocacy, you know, public policy standpoint, but also how do we engage the business community most effectively, and in particular, the social impact investing space or mainstream investors.
You know, thank you for, that's a great question. And that's where a lot of my passion lies. In fact, last September, I hosted a conscious investing event at my home, and we had 50 conscious investors and some conscious entrepreneurs, and really open up that conversation is how do we get investment funds to channel money into the biggest health crisis we have right now, which is mental health. And I'm hosting another event. We haven't set the date, but I think it's June 30th. So if you want to set back, and it will be an online interactive webinar on some of those topics you just discussed. So you can follow up with me, and I'll share that with you.
I think if on the investment side, what I can speak to is, I think like a year and a half ago, I was actively looking at, you know, sort of the landscape of who are the mental health investors, who are the mental wellness investors. And there were just a handful of funds that were focused on this, and they were quite small. And then, you know, I think what started happening over the last year and a half, the bigger funds started allocating some of their capital towards this. And, you know, what's been encouraging is that there've been some kind of larger successes by like Silicon Valley standards, you know, a few unicorns, large rounds being raised, kind of big name investors backing companies. So that has definitely picked up. I know of at least 10 funds that are kind of raising money to then go and invest into the mental health space. But I think we're just in this like awkward moment where we haven't, the investors themselves haven't been able to sort of go and raise the money to then go and deploy into the companies. And I think this is just sort of what's you know, talked about in the investment community, is this is sort of the time for investment, and a lot of very smart and kind of people who really care are doing that work. So I am kind of hopeful. I don't know where people are exactly with their raises due to COVID, but, you know, sort of end of 2018, beginning of 2019, beginning of this year, I've just seen a lot of good movement in terms of these funds raising the money. And, you know, there hasn't been that many deals, but I think we're just in this like period of time where the investors have to sort of go and do the work of raising the money to then deploy. And hopefully, you know, in a year and a half's time, there will be kind of a lot of capital to go into something like this, with COVID being a very big motivator, because I think the problem that these companies are solving has sort of, you know, multiplied a few X.
Yeah, I can just kind of speak to what our experience has been at Lucid Lane. And, you know, we started raising our round literally in November. And it was just before, you know, kind of the COVID-19 pandemic hit. And we were very fortunate to close our round. We raised our seed round led by Battery Ventures. And Battery Ventures, along with a few other VC firms here in Silicon Valley. And we were very fortunate to have closed that round, I think, before the pandemic hit. But what I can also kind of speak to is you know, what the important things that our investors were looking at when we were raising, and how we were able to successfully, hopefully hit all of those those boxes. And one of those was, obviously the pain point. Before there was a pandemic, there was an epidemic, and that epidemic was all the rave. Everybody was talking about the opioids and how people with acute and chronic pain were being affected and just not being heard, and that there was a stigma around that. There continues to be a stigma around that, and we're trying to destigmatize that. The second part is that sometimes there has to be kind of like a perfect storm, and because of the epidemic, legislation started changing, where there's pressure put on doctors and pharmaceutical companies. Everybody heard about what was going on with the lawsuits. And so the Department of Health and Human Services put together a task force. They called it an interagency opioid task force. And they came up with a multidisciplinary approach saying, okay, this is a big problem. We need it to be solved. These are the regulations that we encourage. This is how we want people to move or to look at this problem moving forward. So when you have kind of that regulatory shift along with a significant problem and a kind of a stagnant solution, in that most hospitals or clinics just don't have the scalability or potential to provide the services that is needed on a daily basis at scale, then we were able to move into that space and put together a team that could address it in a very precise way that was also scalable. So I think that having those fundamentals line up was very critical for us. But I think also having a evidence-based, whether it's through data or efficacy, a way to show that not only is what your vision and your product and your idea scalable, but it can help people in this space with concrete evidence. And when you marry all of those together, I think, that provides a compelling argument for investors to look at what you're doing in a serious way. And then lastly, I don't want to, minimize the idea of mission and having a story. Me being an anesthesiologist, I can tell you of two people, one at Stanford, one of my colleagues at Stanford, and then one, where I'm practicing now. Being easily exposed to habit-forming medications that can be, very debilitating and scary has an impact. And suicide and I guess, poor outcomes as a result of that is something that we have to take into consideration. And so it also drives your entrepreneurial spirit and gives you a sense of purpose. So I think if you look at it from that standpoint, and you have a mission behind what you're trying to do, as everybody who's attending this, at 9 p.m. on the East Coast, it's a significant problem, and we're all looking for solutions. So having that story, having the landscape to build upon, and having a really just excited approach and building on that is what I think would be really helpful, Sarah.
Great. Thank you so much. I'm going to I think we're at time. So I just wanted to say thank you to the panelists, Tiffany and Dina and Ahmed, for your time today. I know it takes a lot to sort of plan these panels, especially during quarantine. And so I'm really just grateful that we made this happen. And thank you for the questions and the panelists who joined. We will send an email. I'll ask the Techwadi team to send an email with the links to Lucid Lane as well as MindRise for the discounts. And if there's any other questions, please don't hesitate to reach out. And I think also would love to hear from you if you enjoyed this. It would be great to just get a sense of whether you found it useful and if you enjoyed it, so that Techwadi can continue to host these types of webinars and panels. We are a nonprofit, so all this is volunteer time. So we're happy to be to add value to the community in whatever way we can. So thank you again.
Thank you guys so much. So nice to meet you all.
Thanks for
Have a
having
great
us. I really enjoyed this.
Nice to
Bye.
meet you. Thank you,
Have a good
Yasmeen.
Thank you.
Thanks, Yasmeen.
Thanks, Yasmeen. Bye.
Thank you.
Bye-bye.
Bye.
Thank you, Yasmeen.
Thank you. Thanks, guys.